Hello and welcome back my Arewa family. So if you watch the first part of my video, you actually noticed that I talked about breast milk as the gold standard for LDB. But in this video, we'll be talking about something more. In fact, things that you don't even see in your health magazine. But let's face the one true fact. We know that breastfeeding is not easy at all. Anybody that tells you that it's actually like, because most new mothers are awake at 2 a.m. crying, feeling frustrated because number one, their nipples are cracked, they feel exhausted, feel like their breast milk isn't flowing like a tap. Sometimes the breast tissue entirely feels hard as a brick. In this video, I'll be giving you 3 main reasons why these things happen. Secondly, I'll be talking about the cultural myth that may actually affect your breast milk supply. Lastly, I'll be giving you the medical grade solutions for these problems. So if you're a new mother, expectant mother, or a lady of childbearing age, this video is for you. So don't forget to hit that subscribe button, follow me, like this video, and also hit that notification bell icon so you don't miss my future videos. So let's get started. Now let's talk about the first reason why your nipples are cracked in the first place, or why they are very painful or sometimes even bleeding. It is because of what we know as shallow latch, and I'll explain. Let's assume this bottle represents your breast and this area is your nipple, while this surrounding area is called the areola. The areola is just simply that darkened area that surrounds the tip, which is your nipple. Now we know that your nipples have nerve endings and it's a very sensitive area. So if your baby is just sucking the tip of this nipple, what happens is that this tip rubs against their hard palate, and this hard palate is simply the roof of their mouth, this point. Now, first of all, when you hold your baby in the normal breastfeeding position, what you do is that you advance your breast, or rather the nipple, towards the baby's nose. Now, when you advance it, the baby will now naturally tilt its own head. If the baby tilts the head, the baby will open the mouth wide. At this point, make sure that this their lower jaw accommodates the areola. Before you know, the nipple will reach deep into the mouth to the area known as the soft palate. Now, that soft palate I'm talking about is simply the roof of the mouth, but it's a little bit deeper, alright? And that place is soft, and because of that, there will be no friction between the nipple and that roof of the mouth, and therefore you see it won't be painful. Before you know, your baby can start sucking. Now here's one caution. If after 30 seconds you start feeling pain in your nipples, what you do is just slip a very clean finger, let's say this tip finger, slip it to the cheek of your baby so that you break the suction. And once you do that, try again. As you all know, practice makes perfect, right? So go and do what I just told you. The next issue is that most mothers don't even know how to feed their baby. Now, even though I'm not a lady, I'm going to show you simple tricks on how to feed your baby. Here's the first trick. When you are feeding your baby, please bring the baby to your breast, not your breast to the baby. If you can't do that, just simply use a pillow in order to bring that baby to the chest level. I'm sure if you can master this simple trick, you are good to go. Promise, promise. Also, there are some positions you assume in order to feed your baby. There are 3 positions. I can't explain all of them, so I'll be putting the images on the screen so that you view them. The first one is the cross cradle position. So the cross cradle position is simply the one you use your hand to hold the baby's head opposite the breast you are trying to feed. For example, like this. If you are trying to feed the baby with this breast, you hold the baby with this other hand, as you are seeing, as you can see it also in your screen. And then we'll have the football hold. And this is especially for those mothers who have C-section. You can see it on your screen. There are a lot of positions. Just assume the one you think is best and please practice it. Here's one thing you should know. When you are relaxed and feeding your baby, one thing is that oxytocin is released. And you know what oxytocin is? Oxytocin is a hormone. It will make you feel relaxed. Your baby will also be relaxed. It increases also the bond between you and your baby. So you see, after all, this video isn't useless, right? Now, this is the part of the video I don't want you to miss at all. I'll be talking about the cultural myth that may actually affect your breast milk supply. And these are things that your grandmothers, your big aunties, the old mothers tell you, which are very wrong. Number one, they normally tell you to take gallons of Kunu or soft drink or whatever it is in order to increase your breast milk. What you actually need is simply a balanced diet. Simple and short. Drinking a lot of Kunu or pap or whatsoever it may be might not help. In fact, it may just harm your digestion. So this is what I'm telling you to do. Just eat well. Eat balanced diet and you'll be fine. Your breast milk simply plays a game of supply and demand. As your breast milk gets emptier, it sends a signal to your brain. More milk is produced and more milk is provided to provide for the essential needs of the baby. Now, this leads us to our second myth, and this is very dangerous, so you should listen to me. Sometimes your grandmothers or your big aunties will tell you that your breast milk is watery. Before you know, they'll start telling you start giving your baby pap or some herbal mixtures. Don't try it, especially if your baby is within the first 6 months. Don't give your baby water. Oh. Please practice exclusive breastfeeding for the first 6 months. To have an ear, have heard what I've said. In fact, if you haven't heard whatever I've been saying since the beginning of this video, you see these two things I just mentioned, please heed to them. Don't kill your baby because of your grandma. Don't let them tell you that they have been practicing it even before you were born. My dear, more knowledge has increased and medical practice has advanced. Now, so that this video will not get very long, I'll pause here and then I will continue it in the next part.